What is peritonitis after a diverticulitis bowel perforation? Imagine your colon as a long tube that helps process waste, and tiny pouches called diverticula can form along its walls. When these pouches become inflamed, it's called diverticulitis. Sometimes, this inflammation can become so severe that it causes a hole or perforation in the bowel wall. When this happens, the contents of your intestines, including bacteria and waste material, can spill into the space surrounding your abdominal organs. This condition is known as peritonitis. Peritonitis is a serious medical emergency because it involves a widespread infection within the abdominal cavity. The perforation usually occurs on the left side of the colon, where diverticulitis most often affects. When the bowel wall is compromised, bacteria and fecal matter escape into the peritoneal cavity, triggering a rapid and intense inflammatory response. This response causes the abdomen to become very tender, swollen, and painful. Patients often experience sudden, severe pain in the lower left abdomen, which may radiate to other areas like the groin or back. Along with pain, symptoms can include nausea, vomiting, fever, chills, and sometimes urinary symptoms if the infection spreads nearby. The severity of peritonitis depends on how much contamination occurs. Small perforations might be contained locally, leading to less severe infections that can sometimes be managed with antibiotics and supportive care. However, in cases where the perforation is larger or not contained, bacteria and waste spread freely into the abdomen. This widespread contamination can cause extensive inflammation, leading to more serious peritonitis that requires urgent medical attention. If untreated, the infection can progress to sepsis, a life-threatening condition where the body's response to infection damages vital organs. Treatment varies based on the extent of the perforation and the patient's overall health. Mild cases with localized abscesses may be managed with antibiotics and sometimes drainage procedures, where a needle is used to remove pus. But more severe cases, especially those with widespread infection, often need emergency surgery. During surgery, the affected section of the colon is removed, and the contaminated area is cleaned thoroughly to prevent further spread of infection. This process is called bowel resection, and it is critical to prevent life-threatening complications. Recovery from peritonitis after diverticulitis can be complex. It increases the chance of future episodes and often leads to the need for elective surgery once the patient has recovered. While most diverticulitis cases resolve without complications, peritonitis signals a more serious stage of the disease. It requires prompt and aggressive treatment, close medical follow-up, and sometimes long-term management strategies to prevent recurrence. If you or someone you know experiences sudden severe abdominal pain, fever, or signs of infection after diverticulitis, seeking immediate medical care is essential. Always consult healthcare professionals for personalized diagnosis and treatment options, as individual cases can vary widely.